Here on Facebook. 3, 2. Hello, hello, hello. This is Jenna Cantor, performer and physical therapist, and I'm the founder of Powerful Performer, which teaches performing artists how to be their own health superheroes. And I am with Matt Stenzel. Say hello.
Hey.
Wait, you have to say more words.
Hi, I'm from Australia. Didgeridoo, wombat, kangaroo.
Yes. And we just took a continuing education course to be better with our manual therapy on our people. And I started to talk to him just literally seconds ago and asked him, what are common things that you've seen, abnormalities in posture with dancers? And he told me that you've worked on pole dancers, correct?
Yeah, pole dancers, a couple pole dancers with fitness, and a lot of like dancers who cross over into bodybuilding on stage.
That's so cool. And so what you were saying that there was something that you saw very in common, that they have in common with tightness in their bodies.
High heels is a big thing. Like any pole dancer has to wear heels because it's part of the sport.
Mm-hmm.
Or if you're actually like performing for work, then you've got to wear them too.
Yeah, and or you could even think musical theater performers as well.
Yeah.
If you're dancing in high heels. So this does cross over.
And the fitness performers on stage, they've got to do routines, posing routines, and they've all got high heels on to make, I guess, the curves look better.
Uh-huh.
But it naturally puts you in a really big anterior tilt, and so they get really jammed up hip flexors and lower backs. That's what I've seen.
Yeah. So what are things that you usually have to do to help release and help them out a little bit?
So we do, number one, the treatment that we mostly work on is we work on hip flexors and QLs, try to like even out the tilt in the lower back.
So hip flexor, that's just right here, what flexes your hip, okay? And QL is in, let me come down lower. I'm like showing my bottom right of the thing. Yep, right there in the back, okay, on either side. And then would you, I'm just going to interrupt a little bit longer. So what does the QL do? The quadratus lumborum is the full name of those muscles.
Well, it side bends you side to side, but together with the hip flexors, they tilt the pelvis anteriorly.
Mm-hmm. And that's like this, like the butt is out, or some people have heard it as lumbar lordosis.
Yeah.
Mm-hmm. Mm-hmm.
Yeah. So, but going down to any kind of flexion like you might do, or doing any crazy moves with your legs apart while you've got that kind of posture can be really jamming on things.
Mm-hmm. Mm-hmm.
So that's kind of complaints that we're getting. So we typically do some release work like dry needling or massage work through the QLs and hip flexors and psoas. And then it's all about some advice back home, just to work with their PT about some like things like dead bugs and bird dogs and things to get the pelvis and hips moving independent of the core.
So that would be going back to the glute exercises, your butt. So you would want to strengthen your bottom. You want to strengthen your bottom. You want to strengthen your core. You want to release these areas that are tight. So that is what you can start thinking about if you are performing on heels in any manner right now. That those are probably very likely common areas that need to be worked on or get worked on by him. And then I will teach you the exercises. That's right, the exercises. Didgeridoo?
Yes, didgeridoo.
Didgeridoo.
Yeah.
All right, that's it. Take care, guys. If you have any questions or anything, feel free to write in the comments below, or write in the or private message me. Or if you want to meet the didgeridoo, you can. I tagged him, Matt Stenzel. I want to say like Stenzel, like Denzel.
Yeah, that's basically the pronunciation.
Yeah, Stenzel.
Stenzel.
Yes, yeah. Yes. He's totally related to Denzel Washington, if you can't tell.
Distantly.
Take care. And ending this one, and then coming over here to YouTube and ending here.